where surgery was totally successful. Patient came with extreme pain from last 4 years. She had a sleep disk from 4 years. She could not walk. She was bedridden. And within 3 days of the surgery, patient is mobilized. And she has been discharged from the ICU. So that is the outcome we have find. We are happy with the outcome. And we are very happy with the surgical procedures. We are happy with everything.
Yes, sir.
I congratulate Dr. Emmanuel for all his successful surgeries. May God grant him more success in future. So definitely the classification of low back pain comes into two parts. What is this? Localized to lumbosacral area. Mechanized to lumbosacral area, mechanical pain, and localized to the lumbosacral spine. So this is the two things you will find the problem here. What? One is with the localized lumbosacral spine and one is with the mechanical pain. So this is the most important part which we have to understand. The lumbosacral spine pain and the lumbosacral spine pain and the mechanical pain. So this is the main two classification. What are the two classification? Two classification. One is mechanical, one is lumbosacral. Right? Am I clear?
Yes,
Yes, sir.
So the classification of low back pain is generally called neurogenic, right? Again, we say it is neurogenic pain when the nerves are involved, right? When the nerves are involved, right? And radiculopathy means the pain which is radiating from the lower back. So this is the lower back, this is a disc, and the pain radiating from here is called the radiculopathy. This is called radiculopathy. Pain impinging at the nerve root at the radial site. It is a neural formenia and it is radiating in the lower extremity, in the lower limbs, right? Lower limbs. This is called dermatome and myotome. So whichever nerve is impinged, the pain will radiate to that area. Following a specific nerve root and dermatome pattern is identified. So which nerve root is impinged by from that, we identify the dermatome myo pattern. So the nerve, so this is the same theory which we use in recovery of the paralysis, is the same theory which we use in the recovery of surgery, and this is the same theory which we recovered in the pain management system. So in anesthesia also we follow the same theory. In radicular pain also we follow the same theory while giving nerve blocks, ozone blocks, and other block also we follow the same theory. While using the dry needle also we follow the same theory. Main theory is dermatome and myotome. Right? So when the pain becomes before 6 months, it is acute. From 1 to 6 months. After that, it becomes chronic. So when the chronic pain becomes, there are two things which we have to focus: neural and sensory deficit. So Whenever there is sensory deficit, the sensation becomes less. And neural deficit means the patient is unable to walk. So sleep disk may result to this problem also. What it may result? It may result to neural deficit and sensory deficit. The two things has to be identified. What are the What are the two things? Neural deficit and sensory deficit. Clear? What are the two deficits we have to identify? Neural and sensory. So for neural and sensory, they can be both recovered with the help of neuroacupuncture. Pain can be reduced by blocks, regenerative medicines, PNIT, perineal injection therapy. One therapy which I have taken out was NSNIT. So all these things can be recovered. Post-surgically, pre-surgically, we can recover the symptoms. What important is the recovery of the patient, symptomatically and the real root cause of the disease. The two things we have to understand. There are two types of recovery. One is symptomatic, making it asymptomatic, right? Asymptomatic, right? So the nerve is impeached. Here the nerve is what? Impeached. Impeachment of the nerve is there, right? In the other case, nerve impeachment is not there. So the ligamental phlegm impeaches the nerve. So this goes and impeaches the ligamentum, and then this ligamentum stretches the nerve roots. These are called the nerve roots. They are present in the neural foramina. Nerve roots are present in the neural foramina. So we will have a very good lecture on this topic. So this course encompasses here. So the muscles become weak, the back muscles and all they become weak. So that is why NIBS plays an important role. NIBS plays an important role. 1, 3, 5, 7. In any type of chronic pain, NIBS, quadritum lumbarum, psoas, gluteus minimus maximus, trapezius. So all these muscles, they play an important role in what? Recovery of the patient. So NIBS plays an important role. NIBS means only shifting your finger to 20 degree, 30 degree, like 10 degree, 30 degree, 50 degree and 70 degree. So when you shift your finger in this degree, the muscle pattern also changes. And then when you stimulate with the weaker muscles like gluteus muscles and all, you will see the shortly patient who is having neural deficit, right? Whenever there is a classification, we always write neural deficit or what? What do we write? Sensory deficit. The sensation and neural deficit both can be overcome. So this results can be seen in nerve conduction studies. Where can we see nerve conduction study, MCV studies? So generally we as medical acupuncturist and neuropath, we don't exemplify kidney in, kidney young and all these things we cannot understand. Yeah, they can be used for our better understanding for selection of points. But when we go for medical treatment, we have to understand two things. What are the things? First is mechanical or axial. Write down the notes. Mechanical and axial, local pain, right? Two classification. From here, it becomes neurogenic. When the nerve is impeached. Nerve के ऊपर जब pressure पड़ता है, वो impeach हो जाता है. So in medical, most of the things it will become radiculopathy. Radicular pain means radiating pain. So this is the disc. This is what you know. So this is the disc. So when the disc compresses the nerve, the roots, the pain radiates to the lower limb. Whichever nerve is impeached, the pain will radiate to that part of the limb. It is called radiculopathy. Am I clear to all of you? Whatever am I speaking?
Yes, sir. Yes.
सर थोड़ा आवाज स्लो आ रहा है.
Am I clear to all of you?
हाँ सर
Yes,
थोड़ा
sir.
आवाज स्लो आ रहा है.
Oh, पहले बोलना चाहिए तो गिर गया नीचे. अब आवाज आ रहा है? Am I clear now?
स्लो है सर।
अभी क्लियर है?
नहीं, स्लो ही है सर, आवाज स्लो है थोड़ा।
अभी अभी क्लियर है आवाज?
The sound is clear, sir.
सर
सर
आप
आवाज
इज
क्लियर है
क्लियर
लेकिन
नाउ?
कम आवाज आ रहा है।
वो स्लो
अब
आ रहा है।
आवाज कम आ रहा है, आवाज क्लियर है लेकिन कम आ रहा है सर, बहुत कम।
अभी
नहीं सर, वैसा ही है।
अब
नहीं सर।
अब
नहीं
कैन यू हियर मी?
सर, आवाज आ रही है लेकिन थोड़ा बहुत लंबे से आ रही है। क्लियर मतलब स्लो सुनाई दे रही है।
अब आवाज आ रही है?
आवाज आ रही है सर,
यस
लेकिन
सर,
आप
अभी क्लियर है सर। वो स्क्रीन की तरफ देखा आपने
अब
कि क्लियर रहती है सर।
सर
अब
ये
क्लियर
आप,
है आवाज?
हाँ, आप ये
हाँ
कंप्यूटर
सर
की तरफ
क्लियर।
आते हैं ना। सर ये कंप्यूटर की तरफ आते हैं ना तो आवाज अच्छी आती है। आप लंबे जाते हैं तो आवाज स्लो हो जाती है।
तो मेरी आदत है वो घूम घूम के पढ़ाने की, व्हाइट बोर्ड और उसके बीच में हूँ मैं। लैपटॉप और व्हाइट बोर्ड के बीच में हूँ।
सर लैपटॉप के पास रहे आप तो आवाज बढ़िया आती है सर।
बढ़िया आती है, और उधर स्क्रीन की तरफ गए ना तो आवाज स्लो हो जाती है एकदम ही।
अब ठीक हो जाएगा, अब ठीक है?
ओके
ठीक है
सर।
सर, अभी तो आ रही है।
अब ठीक है?
हाँ सर, अभी आ रही है।
यस
नाउ यू आर क्लियर विथ माई वॉइस?
यस सर।
सर, लाउड एंड क्लियर सर अभी।
So again, I repeat, mechanical, we have to understand the brain, local LBA, right? LBA classification into two parts, right? Mechanical and axial, right? Mechanical मतलब diseases are communicated into two parts, cognitive, no, sorry, communication and non-communicable. So it is a non-communicable disease, right? It is a non-infectious disease. It is a lifestyle disease, right? Because आप रेगुलर अपने मसल्स को रिकवर नहीं करते, आप एनआईबीएस नहीं करते, आप एक्सरसाइज नहीं करते, तो क्या होता है, लोअर मसल्स बिकम्स वीक. So whenever they get a jerk, so they say vertebra like this, right? This vertebra gets a mechanical pressure over here. Whenever there is a mechanical pressure over here, the muscles which are here do not support. So the disc bulges out. These are called the fissure, and this is the liquid. So the liquid comes out and it breaks the fissures, and the nerve gets impinged. So the nerve is gets impinged in the neural foramina. This space is called neural foramina, right? What is this space called? Neural foramina. What is the space called?
न्यूरोफॉर्म।
न्यूरल फॉर्मिना।
Right. So we understood mechanical pain. Mechanical mechanical and axial, right? Localized pain. So it is mechanical because it is a structural deformity. It is a structural deformity. What it is called? It is a structural deformity, means anatomical damage. It is a anatomical damage. It is a damage in the anatomy of the spine. Clear? Am I clear to all of you?
यस सर।
So now, whenever there is a vertebral disc damage, there is a nerve compression. What it is called? Nerve.
नाउ कंप्लीशन।
Yeah. So this nerve compression is called radiculopathy. So the pain, you may not have a low back pain, but you may have a pain in the lower limbs. You may have pain in the lower limb,
एक्सट्रीमिटी।
right? So with the help of acupuncture and all, 70% of the cases can be sustained. But if you correct the anatomy of that area under with a very good spine surgeon, and then you treat the patient, the problem is totally recovered after 15 to 20 years. So it requires two intervention. One is surgical, depending on the condition, and one is rehabilitative and conservative. So in conservative, rehabilitative, you have to use the nerve, you have to reduce the inflammation without using the steroids. So when you give signals to the brain, when you give signals in the brain, my speed is right or wrong? You are able to hear me? Please tell me the feedback, Baba. I don't know. I was speaking for 1 hour. You are saying you are not able to hear me. So one person, please speak to me. Right?
Yes, sir.
Yes, sir. Yes, sir. Yes, sir. No,
Yes,
sir.
sir.
Yes, sir. Yes, sir. No, sir. Voice clear. Noise down. One person should speak to me, right?
Okay, sir. Okay.
Okay,
Because
sir.
my focus is on teaching. I don't have a what you call script. I'm making my own script on the spot, right?
Yes, sir. Yes.
Yes.
Yes,
So
sir.
one person should speak to me. Continuously, one person should speak. After every two sentences, yes, sir. Sir,
Yes,
sir.
sir.
Yes,
Right?
sir. Yes.
Yes, sir.
ठीक है sir.
Yes, sir.
Generally, in medical subject, we call it sir. That means you are able to understand. Sir, sir means, sir, okay.
Okay, sir. Thank you.
So you become neurogenic. Neurogenic means involvement of the nerve. The nerve is called the sciatica nerve. Sciatica nerve is divided from the popliteal fossa. So in back of the knee, you will see what? A crease. Back of the knee, you will see a crease, right? Do you see a crease in the back of the knee?
Yes, sir.
Yes.
Crease दिखाई देता है ना?
हाँ sir.
Yes,
We
sir.
call it BL40, right?
Yes, sir. Bladder fold.
BL40, right? वहां से साइटिक
Yes,
नर्व
sir.
डिवाइड हो जाता है. The sciatic nerve divides from the BL40, right? From L4, L5 से वो पूरा origin एक ही लेता है, but BL40 के बाद वो divide हो जाता है. So when you divide it, it becomes a deep perineal, common perineal, sucral, and all this bifurcation comes from the popliteal fossa. Am I clear?
Yes, sir.
Yes, sir.
So
Yes, sir.
we identified with the help of dermatome pattern. The nerve pattern which is in pitch is called as dermatome pattern. What it is called?
Dermatome
Dermatome pattern. Now, whenever you see a critical cases of like this, they are very good interventions. So initially, we go for pain management. In pain management, I don't know much about this ozone therapy because my results were not very satisfactory, or it may be time taking because we have less patients. We want to finish one case in 1 or 2 days of the back management, right? So we get very critical cases after 3 surgeries, 4 surgeries, right? Uh, uh, three three disc involvements where surgery is not possible, multiple disc involvement, right? So generally, if the case is at 1 level or 2 level, what we say, T-leaf procedure, T-leaf is a fixation procedure, right? So
Yes,
from 1st January, 3rd January, I will teach you how to, in an acrylic model, I'll teach you how to do fixations. So if you do fixation in T-leaf procedure, and more important now is come as oblique procedure, olive.
yes, sir.
So T-leaf, olive, and all these are the fixation procedures, right? So when you fix the spine, it becomes stable. So generally there is a myth that अगर आपने कुछ fixation कर दिया या रोड लगा दिया, patient को paralysis हो जाता है. It is a wrong saying, right? It depends on the surgeon who has done it. For example, now we have recovered a patient of 80 years. How much? I have given in the group today. I think all of you have seen a case study I have given in the group. This
Yes,
is a
sir.
lady who was having only one kidney, 2 heart attacks in 2022 with multiple stunting, and they have given a group photo, and you would really like to see that group photo that the patient has recovered very nicely, beautifully, and she is having no radiculopathy, and she is going with a happy face at home. It was a very critical case because it has multiple spine injuries. It cannot be put very long term in anesthesia because he had no kidney. We cannot go for T-leaf procedure. So we MISS. We could not go for. This is called MISS. What it is called? Surgery is divided into two parts. In spine surgery, it is called MISS. MISS is the best procedure because here you got minimal invasive spine surgery. What it is called?
MIS.
MISS. Miss. हाँ? अपनी वाइफ का मिस नहीं, राइट? लड़की का मिस नहीं, ये स्पाइन का मिस है। इसका मतलब हुआ मिनिमल स्पाइन,
Fine disease.
मिनिमल इन्वेसिव स्पाइन सर्जरी, राइट। तो यहाँ क्या करता है, ये आपका ये स्पाइन है, राइट। तो यहाँ से होल करता है, 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 एंड देन वी फिक्स द स्पाइन एंड वी रिमूव द डिस्क, राइट। यहाँ से हम लोग डिस्क रिमूव करता है, फिर इसको फिक्सेशन कर देता है। तो पूरा फिक्सेशन करने के बाद there will be a pain in the patient. This is called the residual pain or the scar pain. What it is called? Scar pain or neurogenic pain. Again, neurogenic pain may come, right? What it
Yes,
may
sir.
come? Neurogenic
Pain.
Pain.
pain. So we can understand it is mechanical, localized, and
Neurogen.
Neurogenic, sir. Neurogenic.
neurogenic. And neurogenic, there are two factors what we have to say. What are the two factors we have to see? Neural deficit
Sensory
and
deficit.
deficit.
Sensory deficit.
So now one more thing you have to see here. What? MMT.
Okay. Manual muscle testing.
Manual muscle testing, right? So you have to put the, you can see in the YouTube how MMT is checked. Go to YouTube to do homework and to see MMT, right? Manual muscle testing, right? Check resistance. What is the pain? So two things are there. Clinical test, SLRT, right? Side leg raise test, right? So at what angle the patient is feeling pain, right? At what angle the patient is feeling pain. So you ask the patient to lie down in a supine position, and then he gradually raises his leg, right? So at what degree he feels the pain, you can understand the nerve impingement is there. So neuropathic pain occurs from here. So if the neuropathic pain is there for a longer time, the patient suffers from neuropathy. What it is called?
Neuropathy.
Neuropathy.
Neuropathy. Am I clear? So
Yes,
whenever
Yes,
there
sir.
is a neuropathy, the axial sheet of the nerve is damaged. The protein factor of the nerve is damaged. So when the protein factor of the nerve is damaged, what will happen? What will happen?
न्यूरोपैथी डेवलप
Neuropathy, sir.
हाँ, न्यूरोपैथी होने के बाद क्या सिम्टम्स आते हैं?
कंटिन्यूअस
Muscle weakness.
हाँ,
कंटिन्यूअस पेन टिंगलिंग सेंसेशन
या
नमनेस
डमनेस से सब तो आता ही है. You have a dystrophy, atrophy of the muscles, the weakness of the muscles. The density of the muscle becomes weak, and gradually people will have burning sensation. It starts with burning. मिर्ची की तरह चलता है. बर्न जैसे चिली, जैसे पाव में मिर्ची लगा दिया वैसे जलन करता है, राइट. देन वॉकिंग डिफिकल्टी. You are wearing a shoes, but you don't feel the shoes. When you are putting your leg on the ground, you don't feel the sensation. So you have to understand that these are the factors which we understand by this. So few things we have understand from here. What are the there? Mechanical and what? Axial, right? Two classification, mechanical, axial. From mechanical or axial comes the neurogenic, right? From neurogenic, we understand radiculopathy, right? The involvement of the nerve is called dermatome. L2, the nerve is different. L3, the pain is different. The site of the pain is different. L4, the site of the pain is different. L5, the site of the pain is different. And S1, the site of the pain is different. Am I clear?
Yes, sir.
Yes, sir.
Huh?
Yes, sir.
yes, sir.
Yes,
Yes,
sir.
sir.
Yes, sir. Clear.
Do you have doubt anywhere here what I am speaking?
No, sir.
No, sir.
No, sir. No.
So when you don't have all this symptom, now comes the situation. How to revive this pain? So there are two procedures, three procedures we consider as the integration of pain. First procedure comes as ozone. So I don't have much confidence on ozone with this pain management, but in wound healing, ozone has played a wonderful role, right?
सर आवाज नहीं आ रहा है सर।
अब आवाज आ रहा है?
नहीं सर, बहुत स्लो आ रहा है
आवाज
सर।
आ रहा है? अब आवाज आ रहा है?
आवाज आ रहा है सर, लेकिन बहुत स्लो आ रहा है सर।
अभी आ रहा है सर, मगर आपने जो रोम करता है ना सर, तब वो स्लो
अब आवाज आ
स्लो
रहा है?
बंद हो रहा है।
अब
अभी
आवाज
स्लो
ओके
आ
आ
रहा
रहा है
है?
सर।
सर, एक सर, एक सर, यू आर ओके सर।
स्लो आ रहा है सर, बहुत स्लो आ रहा है।
अब क्लियर है?
यस सर,
अब
आप
क्लियर
स्क्रीन
है
के पास
सर।
होते हो, क्लियर आता है सर
हाँ
आवाज।
हाँ।
कहीं क्लियर नहीं है तो मेरे को बता दो प्लीज, हाँ? क्योंकि
Sir,
मेरी आदत
I
है, मैं
get
एक्चुअली
clear.
क्या है,
चालू
see,
सर,
I have a
चालू।
habit of teaching in university, so I don't stand and teach. My habit is same. You cannot
नहीं
change my habit, whether I teach in the classroom or whether I teach in the room. My habit is walking and teaching. Walk while you
ओके
teach.
सर।
लेकिन सर पहले
Idea.
कभी ऐसा नहीं हुआ सर, ये मतलब आज ही ऐसा हो रहा है।
अब पता नहीं क्यों हो रहा है, आई डोंट नो, आई एम नॉट आइडेंटिफायर। किसी ने कोई आएगा आइडेंटिफाई करेगा, कोई ना कोई इंजीनियर आएगा, स्टूडेंट आएगा, आइडेंटिफाई करेगा प्रॉब्लम्स क्या है।
ओके सर।
Sir, we don't get any
Every
problem,
day we
sir.
are facing new problem, every day we'll have to find new solution. That is called neuroplasticity. All problems cannot be solved in the same day.
सर
Before, I don't know how to write in the board. 3 days back, if you ask me how to write in the board, I don't know. But today you see, so nicely I've written everywhere. So there are two types of surgical procedure we see it. What are they? Open and MIS. Right? In MIS, the Cambian approach is very important. Trans-Cambian approach. What it is called? Trans-Cambian approach. So there is a trans-Cambrian triangle where there is a minimal blood loss, right? In minimal blood loss, what happens? You go with this triangular approach, and with the help of two CR. Here we have two CR. In MISS, generally we use one CR. What we use?
Once year.
Once here.
What we use? One CR. But otherwise we use
2 cm.
two CR. How much?
2 cm
And 1.
Two CR. So we take two positions at the same time. AP and
A.
lateral. Right? So there is a minimal radiation. So what is the radiation?
Minimal.
Minimal radiation. So when you have a minimal radiation, what will happen? The recovery becomes very good. You understood? The recovery becomes
First.
very good. So if you find any patient who is having surgery, brain surgery, spine surgery, any of your known person who cannot afford, just talk to me, huh? I'll try to help him out in the best possible way. For all your medical problems, there is one touch solution in Sastry, right? I'll help you out in all your problems and solutions.
यस
Do rely on me, right?
यस
I may not be very good in computer, but in my medical science, I'm good enough. Because I have written 36 books.
यस सर, नॉट गुड, ग्रेटेस्ट।
Yeah, it is one of the achievement we call it.
यस
So now, mechanical and lower back pain in differential diagnosis is called the Hare Rama. Differential diagnosis, right? So it may be central disc. So disc is what? Protrusion. So there is what? Disc bulge, right? Protrusion, paracentral disc protrusion, paracentral disc protrusion, paracentral lateral disc protrusion, extrusion, comes herniation. Herniation is a pseudo term, right? Then comes extrusion, then comes sequestration, right? Sequestration is the last one. So in extrusion only we advise go for surgery. Because if you correct the mechanical thing, the upper disc and the lower disc does not get injured. But after surgery, they say upper disc and lower disc can injure. But if you apply NIBS, because the modern neurosurgeons, they do not know the power of NIBS. They never studied about the brain map.
No.
Yes. The problem with the neurosurgeons, they did not study the brain mapping. They do not know how to strengthen the paraspinal nerves. So in physiotherapy also, they did not study all these things. What they study, so once there is a cut, the muscles becomes weak. So when you give a small cut over area which is gets healed up gradually, but the lower back muscles becomes weak. These muscles which is supporting the disc becomes what? Weak. It becomes what?
Weak.
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 So neither the ozone nor the physiotherapy or all these things takes a longer time. Neither I will not say it takes a longer time. But if you do brain mapping with 246 using brain muscle pain, then what? Instant and fast. So on 26, 2 people are coming from learning from me. One Sachin is coming. Huh? Pawar, when are you coming to learn here? 26 तारीख को आ सकते हो पवार? Pawar? 2 people are coming from South India. तो ठीक है, जो आ सकते हैं आ जाओ, जो बाद में आना चाहते हैं बाद में आ जाओ. Just talk to Sandeep before coming, right? Whether I am there or I don't know. I also don't know my date. And biggest problem with me is that I invite you, but I am in Bangalore. So I make my planning in the road. So I spoke to Chayan, sir, where are you? I'm in Bangalore. Sir, I am coming. I don't take anything. Aadhaar card and my ID card is always there. I make my ticket. I'm in Bangalore. And I tell them, I'm coming day after tomorrow. Where are you? Sir, I'm in Bangalore. Where? With Chayan, sir. So where are you? I'm in Karat. Where are you? Yes, whenever I want to go to Karat, I go to him. Or whenever there is international conference with Dr. Abbasi or anyone good neurosurgeon coming up who knows me very well, or even if he goes, what you called, this boy, Emmanuel, or any of my friends who goes to the conference, मैं उसके साथ चला जाता है. So most of the thing what we must understand, today also we got one patient who has a very acute pain, right? Very acute pain. We thought he is having stenosis at L2 level, right? So the pain was only in the localized area. Well, this is the L2 level. So the pain was only in this local area and in the gluteus area. So after giving number of blocks and everything, the pain did not subside. So we did not rule out the sacroiliac part, right? We did not rule out the back pain. The patient has a history of chronic smoker. Chronic smoker. So identification of the infection was not ruled out. But what we did a SI joint MRI. SI joint MRI, right? So whenever I have to do, I generally see when the patient is having too much pain and is having too much radiculopathy in the gluteal area, I generally go with MRI whole spine screening with SI joint. Because if this is a sacroiliac joint dysfunction, it is called sacroiliac joint dysfunction in the sacroiliac joint, right? So if there is no pathology in the disc, no problem in the disc, right? No problem in the
Disc.
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 Then sacroiliac joint has to be identified. So in 70% of the cases where we see the patient is having continuous pain, so facial arthropathy, this is facial arthritis, right? And sacroiliac joint pain. These are the two important things which we have to focus on the case. So sacroiliac joint and facial arthropy is one of the most common reason where disc, facial arthropy and SIE, when these three are involved, very difficult, right? And one more thing you have to understand in sacroiliac joint, it is unilateral and bilateral. What it is? Unilateral and
Bilateral.
Bilateral.
yeah. So if it's unilateral, what do you understand? One side. What do you understand?
It's one side
One
issue,
side.
Come on. Huh?
Both
one
sides.
side problem.
One side problem.
No. Both sides.
No. If it is
Bilateral
on
is
one
both
side,
side.
if it is on one
Unilateral.
side,
Unilateral.
unilateral. So what do you understand by unilateral pain?
Both sides. Both sides.
Infection.
Okay.
He may have bone TB or other infection. Infective etiology. What we call it? Infective etiology. So here what we do it FNAC. What we do it? First we do contrast MRI. So whenever you see any such patient having low back pain from a long side, you have to write him MRI, LI span, whole spine screening, right? Wet, normal or contrast study. Normal, see if required. See matlab contrast if required, right? Also study the sacroiliac joint. Also study the
Sacroiliac.
sacroiliac joint. Right? Because in 60% of the patient, you'll find sacroiliac joint dysfunction. You got my point, Datta Sai?
Yes, sir.
Yes, sir. I am just, sir, any type
So
of
if
low
it is
back pain.
bilateral, if it is bilateral, we call it ankylosing spondylitis.
Okay.
The chances of having ankylosing spondylitis, it is HLA-B27. It comes under DMRT, means arthritis, rheumatoid arthritis. So the medicine which we give is DMRD medicines, anti-rheumatic medicines like Sejo, Visolon, Prednisolone, Methotrexate. We give this type of medicine, right? Nowadays, biological therapy is also there. Clear?
Yes.
But when it is unilateral, it is infective. So we have to identify it with the help of biopsy. Right? We have to identify it with the help of biopsy and FNAC. What is FNAC?
Fine needle.
Fine needle aspiration and culture. FNAC is what? Fine needle aspiration and
Culture.
culture. This is done by interventional radiologist. It is done by CT guided procedure. It is done under CT guided. Right? It is done by interventional radiologist and it is called CT guided procedure. It is called what?
CT.
Yeah. Under the guidance of CT, you go inside and with the help of the biopsy needle, you take out ek tukra nikal ke le aata hai. And then we do it culture. So fine needle aspiration means we go with a very fine needle and we take out one fluid of that area and we culture it. So
Okay.
to rule out any type of infection, we have to see, we have generally there is a thumb rule. What is the thumb rule? You have to take 5 types of test. So in some tests, you will see CRP is high, right? CRP is an indicative factor of inflammation and infection, right? So whenever it is there high, you have to be a red flag. It may be because of inflammation, it may be because of what?
Infection.
Infection, clear. So it may be aerobic or anaerobic infection, right? So when the patient complains of acute pain, always remember, always go for urine culture.
Urine culture, sir. Okay.
In 70% of the low back patient or spinal cord injury patient, we will find one most important thing is urine infection. What we find is
Urine infection.
Urine
UTI.
infection.
Yeah,
Oh,
yeah, UTI. Here from here you can understand which antibiotic is sensitive. to the bacteria. All antibiotics are not sensitive to all bacteria. You may have suffer from any infection, right? You may suffer from any
Infections.
infection. So identification of this infection is done by the culture and sensitivity test. It is done by the culture and
Sensitivity.
Sensitivity test.
yeah. From this culture and sensitivity test, we identify which bacteria is involved. Accordingly, that we give that medicine. So sometimes UTI infection also creates a lot of severe pain. Fever spikes are there. So you will find one most important is the fever spikes, right?
Hmm.
Am I clear to all of you up to now?
Yes, sir.
Yes, sir.
Yes.
Yes, sir.
Anything you are
Yes,
finding
sir.
a problem to understand?
Sir, may I? Sir, you said
Yeah,
five,
please.
five thumb rule something like, and you started with CRP. What are the
I
other four?
can. Your voice is not clear, Baba.
Sir, am I audible, sir, now? Is
क्या
it
बोल
clear,
रहा
sir?
है गाला क्या बोल रहा है
सर,
नहीं
आप
सर
बताए थे कि थंब रूल, फाइव थंब रूल करके बोले थे सर, और सीआरपी बताए, बाकी फोर कुछ है सर?
क्या बोल रहा है ये क्या बोल रहा है
सीआरपी पता है बोल रहे हैं और कुछ भी रूल आउट कर सकते हैं क्या?
हाँ
सीआरपी ऐसे बोल रहे हैं, सीआरपी पता है और कुछ रूल आउट हो सकता है क्या?
नहीं लिख के
Yes,
दो
sir,
और
yes,
कुछ
sir.
rule
यू
out-
राइट डाउन बाबा
यस सर.
राइट डाउन इन द चैट बॉक्स वॉइस कट कट के आ रही है योर वॉइस इज कटिंग डाउन माय वॉइस इज क्लियर टू यू
Yes, sir.
Yes, sir,
Yes,
yes, sir, your voice.
Yes, sir.
माय वॉइस इज क्लियर टू
Yes,
यू
sir.
Yes,
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 sir.
clear.
So whatever written is not clear. See, they told me that this can cover a meter of 600 meters or 300 meters. From 550, 10 meters only, not even 10 feet or so, the voice becomes unclear. So whatever is written in this, what you call company, is also not correct. You only come to real experience when you do the work on the what?
Patient.
Patient.
Yeah, field.
Sir, he is right answer. Sir, लिख दिया है chat box में.
The disc is comprised of various pathologies. As per pathology, we have to go for surgery. As per surgery, after surgery, there is a lot of weakness. So NIBS helps you to recover this weakness. And then when you operate NIBS, it is a very called non-invasive brain stimulation because you don't touch the brain. You just go to the scalp, you stimulate, and you see the strengthening of the muscle. You recover both the neurogenic, neuropathic symptoms, post-operative symptoms. In post-op cases, NIBS is very important because it gives you muscle to muscle recovery. Once you get muscle to muscle recovery, what will happen? Muscle to muscle recovery, when you get a strengthening in the group muscles. You get strength in the group muscles. So post-operative complication is what? One level up. So the disc is separated at L4, L5 level, right? So one level up, L5, S1, L3, L4. One level down, L5, S1. Right? Pain is involved. Hello. Yes. न्यूरो हॉस्पिटल हैदराबाद लाइन काट दीजिए सर You got my points, whatever I taught you today?
Yes, sir.
Yes, sir.
yes, sir.
Yes, sir.
So it is called mechanical low back pain, which is involved with the disc, right? Then facetal and sacroiliac joint. This very important part which you have to understand. Am I clear to all of you?
Yes, sir.
Yes,
Yes,
sir.
sir.
In post-operative cases, what are the problems you will get?
Post-operative.
Yeah, the symptoms continues. We go with pregabalin or gabapentin, but this is anti-epileptic drug, right? So I don't choose gabapentin. They give gabapentin, not triptyline, right? Or pregabalin, right? So initially the patient will have vertigo and all. Pregabalin can be given at 600 milligram daily. And it can goes to 118 milligram as per the weight of the patient and tolerance. But generally I give only once daily and then I withdraw it. Today I have written why withdraw, the patient becomes psychogenic. So after giving 6 months, it becomes very difficult to withdraw. It is just like a drug. Gabapentin cannot be withdrawn because it is a sleeping drug. It helps you to involve sleep. It involves the radiating pain. So you become addicted to it. So it is very, very difficult to do what? Withdraw
Immediate.
gabapentin. Right? Am I clear?
Yes, sir.
Yes, sir.
Am I clear to all of you?
Yes, sir.
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir.
You will learn more things, right? It is just a beginning.
Sir, your handwriting can be changed. It will be more clear.
My handwriting can never be clear.
Yes. Color. Sir, I mean color. It is light red. Can it deep it?
You want a deep color?
It is-
Okay. Which color
Yes,
do you
yes.
want?
Any bright,
Which
any
color
bright
do you
color
want?
will be.
Yes, sir. Yeah, any bright color. Thank you.
Wait a minute. I have yellow, blue, pink,
Blue, sir.
maroon, blue.
Black.
Dark
Blue
blue
or
can we do?
maroon?
Black is same. So we'll go with dark blue.
Right.
Dark blue, it's
Blue.
okay.
Ancient and powerful. This color is okay?
Blue.
This color is okay?
No. No, sir.
This color is okay?
Yes, it's okay. You
Okay.
can see it.
Okay.
It's visible. Yes. It's contrast.
Okay,
Huh?
sir.
But it's light, sir.
Yeah,
I
yes,
more
it is
dark
light.
color.
Intensity should be higher.
Yeah. That
Yes,
I
is
sir.
never
right.
include the
Yes.
intensity, Baba. It is a digital box. I don't know much about it.
Yes, sir. Now it
I'm
is
learning
clear,
every
sir.
day.
More clear. Now, yes, sir. Thank you.
Yes.
It is it is clear now, sir.
Okay. So you have to go to your comfort zone, right? So generally, mechanical low back pain differential diagnosis, here you find out stenosis. So stenosis will teach you another lesson where you got what is spinal stenosis? Can anyone tell me?
Sir,
Narrowing.
Decrease in narrowing.
One
Canal.
person at a time.
Narrowing of the
Huh?
spine. Narrowing.
What is stenosis?
Narrowing of the
Come on
canal.
here.
Sir.
Sir, narrowing the space in the spinal
Canal.
that
Neural
create
phenomena.
pressure on the spinal cord.
Huh?
That create pressure on spinal cord.
Compression
That
on
is
the
narrowing.
spinal canal. Compression
Yes.
on the spinal canal.
Yeah. Yes. Yes.
Right? Compression on the
Again.
canal. Right?
Narrowing, sir. Stenosis means
Hello. Hello.
yes, sir.
Yes. Wait, madam. Hello. Yes. Phone cut here. So narrowing or compression is the same thing. Whenever you compress it, it becomes the canal becomes narrow, right?
Yes, sir.
Hello. Hello. So now you can see intra-articular stress fracture. That is also very part intra-articular stress fracture. We'll take a special class on this part, right? Stress fracture. So whenever you see in osteoporotic cases, you find this type of stress fracture or traumatic cases, you will find what? Stress fracture. So spondylolisthesis, right? What is spondylolisthesis? It is a vertebral displacement. For example, L4 is here. So from here, the spondylolisthesis is here. L5 over S1 over L4. The displacement of the vertebra. It is called what? Displacement of the
Vertebra.
vertebra.
Okay.
Right? It is called what? Displacement of the vertebra.
Vertebra.
Here nerve is impeached. Nerve is
Impinged.
Impeached.
So it is divided into 4 grades. So what are the grade? 1, grade 2, grade 3, grade 4. Am I clear?
Yes.
Yes, sir.
Am I clear, Mohammed Singh?
Yes, sir.
Sir.
Mohammed Singh, do you have any doubt? I see some doubt in your face.
नहीं कोई डाउट
So
नहीं
clear है
सर
Ampal?
बिल्कुल सर बिल्कुल
तो स्पॉन्डिलिटिस इज वन ऑफ द थिंग. इसमें क्या वर्टिब्रा का डिस्प्लेसमेंट हो जाता है. वो एक आगे हो जाता है, एक पीछे हो जाता है. इसको 4 कैटेगरी में डिवाइड किया जाता है. व्हाट आर 4 कैटेगरीज? 25, 50, 75, 100. Right? Grade 1 can be managed. Up to grade 2 it can be managed, but grade 3 and grade 4 require surgery. But today even in grade 1 or grade 2 I prescribe surgeries. Because of the lifestyle of the patient. Because patient's lifestyle is very bad. Right? अब आप देखो, एक बच्चे को खो खो खेलना तो आता नहीं है, वो शुरू से वीडियो गेम के साथ खेला रहता है. So you have a thumb injury and I call it mouse syndrome. This syndrome. Mouse syndrome. Most of the people have mouse syndrome and thumb syndrome. They don't have any syndrome because they don't do badminton, they don't do outdoor games. So their muscles are very weak. They generally go and do this push-ups, this. All this is okay, but you need a very good, what you call badminton, this, hockey, all these things are required.
দেখো
Right?
বাবু দেখো আমারও ক্লাস হচ্ছে আমিও দেখতেছি.
Yeah. Lumbar strain and lumbar pain. So this is also one of kind of pain which can be very well recovered by NIVs. But the diagnosis has to be confirmed by MRI, right? Infective, non-infective, fracture, listhesis, discogenic. Discogenic means what? Involvement of the disc. Am I clear?
Yes, sir.
Am I right or wrong?
Yes, sir.
You are clear?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Are you clear?
Yes, sir.
So other is what? When there is no Ayurama. So one more differential diagnosis comes here. What is this? So if you have a pain in the gluteal region, what? Gluteal region. Yeah, पिछवाड़े में दर्द हो रहा है, right? Continuous while walking and all. Especially in the male cases, we keep it because of the pulse. So the piriformis muscle impedes the nerve. So what is the differential diagnosis between piriformis syndrome and piriformis syndrome and slip disc at L5 S1? What is the differential diagnosis? If the disc pathology is not involved, if this is not involved, right? Then it is piriformis syndrome. The piriformis muscles keeps impinging the nerve. So if you see the MRI and you see there is no L5S1 or L4, L5 involved, right? And still the patient is having what? Pain. Still the patient is having pain, right? So we call it piriformis Rama. You call it what?
Piriformis
Piriformis.
syndrome.
Piriformis?
Syndrome.
That this should not be involved. What is the diagnosis? That this should not be
Involved.
So NIBS 246 in the gluteal region. It releases the piriformis muscle. It releases the piriformis muscle. The pain uses brain muscle, advanced brain stimulation. These two muscle at 246 in the gluteal region, that is this region. Put in the scalp area at 20 degree and 40 degree, and then you will see piriformis syndrome, which requires acute surgery, is recovered. I've recovered large number of cases only with piriformis syndrome using this, because the muscles get relaxed. Once the muscles get relaxed and the brain performs a what you called pattern of recovery, piriformis syndrome is recovered. So when I took this time the patient with acute low back pain and all this thing, the doctor was not ready to operate. You know why? Because the patient was asymptomatic. There was no symptom, but there was a mechanical problem. I said, sir, you please operate it. I have no option because I managed the patient for 4 years. I want to finish this chapter once for all. Clear? So other nerve which is lateral piriformal, femoral cutaneous nerve entrapment. So this is also another problem. Tumors and
Lyme disease.
Lyme disease is autoimmune disease, right? It's an autoimmune disease. Clear? Entrapment means the compromise. The nerve is compressed. So the femoral cutaneous nerve also can be released with the help of without surgery, right? So many things can be done without surgery. Many things require surgery. Many things requires supportive treatment. Alone surgery says I am good. It is not possible. Alone you say NIBS is possible, not possible. So you must have a very good knowledge of medical science while you deal with pain management. Generally, why all these things are not successful? Because we are not able to diagnose the patient. We are not able to do the diagnosis of pain management. We believe all the pain comes under disc, right? So I'll be teaching you femoral cutaneous nerve impingement, entrapment in a very nice way. The tumors also in a very good way, and the Lyme disease also in different lectures, right? I'll teach you in details about all these things so that you don't get confused, and also about the piriformis syndrome. So all these topics in future will compromise with the detailed lectures. Am I clear?
Yes.
Yes, sir.
I hope my
Yes, sir.
handwriting is not a very big problem for you.
No, sir, it will clear us.
Hello? Yes. Yes. I hope my handwriting is not a problem for you, right?
Yes, sir.
So it is my advice, those who are learning the class, please buy the pen, at least few pens you buy and you start practicing. Otherwise, whatever you learn is no use, no certification, nothing you will get. Only learning will not help. If you cannot practice and if you cannot perform on the table, if you cannot answer some questions on the table, the patient is on the table, and if you cannot recover the patient, if you don't try from today, tomorrow you will not be successful. Today is the right day to try. Tomorrow is never a day which will come to you.
Yes, sir.
I've been hearing this years from 100 years. After my death also, I'll be hearing only yes. Because whatever you say yes, according to me is no. So this is the face of the disc. This is called the lamina. This is called the lamina. This is called the nerve. So that this is called the annulus. This is called the nucleus. Right? So this is the disc. What is this? This is the disc. So in MRI, you will get this picture. So this nerve goes and compresses the nerve over here. This is called nerve impingement. It is called what?
Nerve
Nerve?
impingement. Nerve impingement.
Yeah. So if this breaks up here, this breaks and this fluid comes out here, it's called herniation. But if it gets a major black, it breaks up majorly and the fluid comes out majorly, it is called extrusion. But if the filament is gone, it is called sequestration. We understood? So these are called the nerve roots. These are called what?
Nerve roots.
Roots. And this is called the spinal canal. So whenever there is a canal stenosis, the nerve is placed here. This is called the spinal canal. Right? And this is called the mechanical pain. It is not an infective pain. It is not an infective pain. It cannot be recovered by medicine. Lifestyle correction, forward bending, sitting on the floor, jerking movement. All these are important.
Yes, sir.
Hello? Hello? So for example, you give a jerking movement. So the upper spine gives a movement here, base here. So this goes a jerking. So again, if you get a jerking and it also jerks from here, what will happen? That this will damage what?
Okay.
This will damage further. Then this will damage what? This will damage
Nerve. Spinal nerve.
further. It is called the further degeneration of the
Disc disintegration.
disc. You understood? This is called the lamina. So when we cut this one, it is called laminectomy. So when we remove this lamina, this gets space, right? And the nerve impingement is reduced, nerve inflammation is reduced. But the disc we do not do. In endoscopic procedure, we generally remove the extruded area. But when there is total problem, we remove the entire disc. It is called what? Discectomy. It is called
Discectomy.
discectomy. What it is called?
Discectomy.
When we remove the disc, it is called
Discectomy.
discectomy. Generally, this is the trend that we do fixation.
Yes.
Fixation is very important. One level up and one level down. So generally we do it one level up, one level down, or at the same level. Am I clear?
Yes, sir.
Yes, sir.
Yes, sir.
So here you can see various type of areas where the nerve is impinged. This is L4, L5. The safest area to operate is L4 and L5 area. This is sacrum 1. This is sacrum 1. This is L4, L5 area. This is L5. This is L5 area. This is S1. This is S2. Right? Here comes a cordalicuna. If cordalicuna nerve is there, you'll have what? Incontinence of bowel and bladder. What you will have? Incontinence of bowel and bladder. You won't have the feeling of urine and washroom. Am I clear?
Again, sir, it's not clear.
Tell me.
Again, please.
You write and give me. Your voice is not clear.
Incontinence of what, doctor?
Shilpa? Shiraja, I am not clear with your voice. Write down in the comment box.
सर रिपीट समझाइए ऐसे बोलो
हाँ?
रिपीट रिपीट सर
कुछ समझ में नहीं आ रहा आप क्या बोल रहे हैं.
रिपीट वापिस समझाइए सर नहीं समझ में आया
हाँ?
फिर
समझ
से
में नहीं
समझाइए
आया
सर, रिपीट समझाइए।
आपकी आवाज
देखो,
क्लियर नहीं है सर, दोबारा समझा दो।
बावेल ब्लैडर का इनकॉन्टिनेंस का उनको रिपीट चाहिए सर।
इनकॉन्टिनेंस का मतलब होता है पेशाब और पैखाने का फीलिंग चला जाता है. यू वांट टू गो यूरिन, यू नो यू आर हैविंग ए यूरिन सेंसेशन, राइट? बट अगर कॉर्डल इकोना कंप्रेशन हो जाता है, व्हेन द कॉर्डल इकोना नर्व इज डैमेज, राइट? कॉर्डल इकोना नर्व क्या बोलते हैं उसको? कॉर्डल इकोना. क्या बोलते हैं? कॉर्डल
Coda
icuna.
icuna.
Whenever there is a problem in caudal icuna, what will happen? Incontinence of bowel and bladder. तो हम लोग हमेशा L4 L5 को स्लिप डिस्क को बहुत कैजुअली लेते हैं, बट वी फॉरगॉट दैट इट में हैव ए लॉन्गर कॉम्प्लिकेशन. इट में हैव ए लॉन्गर कॉम्प्लिकेशन. इससे क्या होता है? कॉर्डल इकोना सिंड्रोम हो जाता है. कॉर्डल इकोना का मतलब ये होता है कि आपने जीवन भर के लिए आपको यूरिन कैथेटर या SIS या पेशाब पैखाना को आंगली घुसा के निकालना पड़ता है. So it's a very difficult situation. You don't have a control on bowels and bladders. बात समझ में आया? इनकॉन्टिनेंस का मतलब क्या होता है? बावल और ब्लडर यानी पेशाब और पैखाने का फीलिंग चला जाता है. You don't understand whether you want to defecate or you don't want to defecate. Am I clear?
Sir, yes.
यस सर
हाँ?
Yes, sir.
यस
Sir,
सर
yes,
sir.
sir.
Yes, sir.
So this is called dermatomyotome, right? Here you can see T10. Here you can see T10.
नो रूट पेन
See, while doing, I have learned lot of things. एक एक चीज से मैं सीखते जा रहा हूँ बोर्ड के बारे में, राइट? So this is T10, T11, the pen is here, T12. Now if you see the compression is L1, here you will see the, but near the genital area, if you see S1, S2, S3 is the pain. So here is 2 L2, here is 3 L3, L4. So now when there is a pain in L4, you also find the pain in the knee joint, right? Here is the L5, here is the S1. Am I clear? So L3 pain goes like this. This
Yes.
called, this nerve roots are called dermatome and these are called myotomes.
Yeah.
The nerve supply. This nerve supply is also used to recover paralysis. That is why we go for nerve conduction velocity test. I am the first one who have integrated NCV with paralysis recovery. So my results are very good, 70 to 80% in paralysis. I work with stem cell therapy, NIBS. I have multiple factors of NIBS mapping. I have multiple, because when I work with joints, recovery of the joints, PRP, प्रोलो, तो सब करते तो क्या रिकवरी कितना अच्छा होता है? फास्टर लेवल, FSTR फास्टर लेवल. सो हियर यू सी L4 L5 में पेन होने से कहाँ होता है? L3 L4 का पेन कहाँ होता है? So it is called the sensory zone. What it is called? The sensory
Joint.
zone. You understood? और पीछे का भी आप देखो तो ऐसा ही मिलता है. S1 S2 and here you see L3. So here is the popliteal fossa. यहाँ के नर्व डिवाइड हो जाता है परिफॉर्मिस मसल में, डीप पेरिनियल नर्व में, डीप पेरिनियल नर्व. परिफॉर्मिस मसल यहाँ होता है, ठीक है? समझ में आया बात?
Yes, sir. Yes, sir.
This is called
Yes, sir.
dermatome and myotome. Again, we'll have a detailed lecture on each part, right? So whenever there is a deficit, you will find S1 deficit. The pain of S1 deficit at what? Achilles tendon and patella. So in patella, the pain is because of what you call calcaneal part also.
He doesn't know how to explain very well.
One thing I forgot to tell you, please maintain the group discipline. The chief principal neurosurgeon from Zimbabwe University has entered our group, right? IP Cherian has entered our group. So senior neurosurgeons are in the group. Please don't allow anyone to put any advertisement in fellowship group, right? You got my point?
Yes, sir.
Yes,
Yes,
sir.
sir.
Yes, sir.
Yes, sir.
Professor Kazadi and all are in the senior group. So if you do all these things, it will destroy your impression. You will not get your certificates. And if you are expelled by them, I cannot do anything. They are the authorities of the organization, right?
Yes, sir.
Okay.
Yes, sir.
So you have to maintain the discipline of the group. If he gives any negative comment, it will be very bad on your career.
Yes.
So the hip flexor identifies the LP. Achilles tendon. Hip flexor identifies the L3, right? Quadriceps and anterior tibialis is identified by L4. Extensor and hallucis longus is identified by L5, and flexor hallucis longus is identified by S1. So these are the myotome of the muscles which identifies the pain. Hello. Hello. So in this pattern, all this pattern, whether you have a discogenic pain or nerve entrapment or anything, a good recovery can be given by NIBS. Because NIBS immediately releases serotonin, dopamine, pain relieving hormones, and strengthening hormones. What? It releases the strengthening hormones. This is the inner capacity of the body to recover the pain. Whatever we need is inside the body. Body called Visolon, morphine, fentanyl, all whatever we give from outside is already inside the body. Am I clear? Whatever we give from outside is inside the body. So now if you stimulate and give a signal that I want this, for example, Ompal, if I ask you
Yes, sir.
2,000 rupees, will you say me no? Ompal, give me 2,000 rupees tomorrow for running the class. Will you say me no?
Yes, sir.
Ompal,
जी सर.
मैं आपसे कल 2,000 रुपया मांगा कि मुझे क्लास चलाने के लिए 2,000 रुपये चाहिए, मेरे पास नहीं है, आप मुझे ना करोगे?
हाँ, अब ना भी कर सकता हूँ, अगर होंगे तो हाँ भी करूंगा सर.
मुझे चाहिए नहीं. इसको बोलते हैं कम्युनिकेशन.
जी
आप
सर.
जो बोलते हैं अभी कर दो, इसका बोलता है NIBS. दिस कम्युनिकेशन. बट आपको
जी.
मैं बोलेगा ही नहीं तो आप देगा कहां से?
बिल्कुल सर.
बात समझा?
Yes, sir.
बिल्कुल.
मुझे आपसे कोई पैसे नहीं चाहिए. आई एम जस्ट गिविंग यू एन एग्जांपल. मैंने आपसे पैसे मांगे, आपने पैसे दिए. तो ये कम्युनिकेशन, जो मांगना और देना, उसको क्या बोलते हैं?
Communication.
Communication.
That communication is established by what? NIBS. So only the stimulating the lower back does not recover the patient. खाली डर्माटोम मायोटोम पर माथा लगाने से नहीं होता. You have to strengthen this muscle. Anterior tibialis, hallucis longus, right? In different formats. So एक बार ये recovered हो गया तो झमेला. The problem is
So,
solved. So you don't try to solve the problem. So the problem remains unsolved. You got my point?
Yes, sir.
The most important part, if you see, is the progressive weakness. What important part you see is the progressive neurological deficit. We call it neural deficit. What we see? Neural deficit. It is called weakness of the muscles, which we have seen in the previous slide. It is called myotome weakness, identified by the dermatome. Which muscle is weak? The local identification of the muscle, right, with the nerve impeached, right, with the nerve impeached, identifies the what? Muscle in trouble. So that can be resolved by NIBS.
yes.
So I advise all the people, just try to learn NIPS very nicely, because without this, acupuncture or any type of critical neurogenic problem, pain problem cannot be solved, because I understand what is the complications we are facing. So at least every person should have 3 to 4 pains in their clinic while you recover. Otherwise, you are just what? I'll call in my language, you are just doing a drama. You are giving painkillers, you are giving, whether you give painkiller by mouth or you are giving painkiller by transmission or you are giving painkiller or you are making asymptomatic. All these things, residual symptoms, main symptoms will persist because you are not correcting it from the what? Central jaw. Am I clear?
Yes.
Yes, sir.
So this is called caudalic and this is called incontinence of
Bowel and bladder.
it is called retention. Retention means what?
It's not event.
You are not able to pass the bladder and you cannot clear your
Bowel
washroom.
and
You cannot go to washroom by your own. So you have no sensation. You will pass the urine in the bed, you will pass it, you don't know. It is called what?
retention.
Retention.
Caudal syndrome.
Syndrome.
It is defined as incontinence of bowel and
Bladder.
bladder. Or it is called neurogenic bladder. It is called what? Neurogenic bladder. It is compressive and non-compressive. Right? Am I clear?
Yes.
Compressive because of the disc, non-compressive because of the autoimmune factors. Am I clear?
Yes, sir.
Yes, sir.
So when you get no significant importance in 4 to 8 weeks of the treatment, you should suggest for surgery. And so when you suggest for the surgery, 2 things are important, right? Just don't think every orthopedic surgeon is a spine surgeon and every spine surgeon is a competent surgeon. So whenever you go for surgery, always choose the best centers, right? So if you ask me, I'll ask Dr. Atul Goyal, Dr. Aib Cherian, Dr. Mohammad Abbasi, Dr. Agarwal from MJP Royalkhand University. Royalkhand is a medical college. So these are the giants of this recovery. So when you see from 4 to 8 weeks the patient does not recover, you should go for what? Surgical intervention. And post-surgical intervention also neuropathic pain will be there. The neuropathic pain can be recovered by NIBS and acupuncture. It is called neuroacupuncture. That is why the problem is we prescribe pregabalin and post-operative. Pregabalin, nortriptyline, and gabapentin. With now the tramadol is banned, so we give it diclofenac. 75 milligram SR. Sustained release. Or we give a patch. Diclofenac patch. Right? So all these are there to improve the cases. Clear?
Yes.
So you may ask me a question. Anything important? I think all we have cleared.
Yes, sir. 92.
I called you central lateral. All this I have taught you, right?
Yes, sir.
So I have told you spinal canal, right? This is the canal. So this is the canal. Learning from us is very good because in one slide we can teach you everything. So this is the canal. So if this disc compresses the canal, it is called canal
Stenosis.
stenosis. This is called the lamina. This is called the nerve root. This is the central canal. These are called the nerve roots, right? This is the foraminal space. This is called the neural forminia. What it is called in MRI? Neural forminia. So encroachment of the nerve disc in neural forminia is called foraminal encroachment. This foraminal encroachment will get nerve root irritation. Nerve root irritation will create what? Radiculopathy. That is neurogenic pain. Clear?
Yes, sir.
Yes, sir.
What clear?
Yes, sir. Yes, sir.
हाँ एंथनी बोलो.
हेलो
हाँ एंथनी बोलो.
सर हाउ आर यू सर
आई एम फाइन एंथनी.
सर वन ऑफ माय ब्रदर उसको ब्रेन स्ट्रोक हुआ सर.
हाँ तो कोई बात नहीं.
तो ब्रेन स्ट्रोक हुआ, उसको सर्जरी भी हो गया.
ठीक है, बढ़िया बात है.
तो उसको मूवमेंट नहीं आ रहा सर.
वो तो पैरालिसिस हो गई. ब्रेन स्ट्रोक के बाद तो पैरालिसिस मौत को कॉमन सिम्टम है.
जी सर.
वो तो लाना पड़ता है.
मैं बोला कि मेरा सर है
हम्म.
विल गो देयर कि वो ट्रीट करेगा तो तुम्हारा 100% सक्सेस. इज
देखो,
यंगस्टर सर 40 इयर्स.
हाँ इट्स ओके, रिकवरी आ सकता, बट कभी भी किसी को 100% गारंटी मत दो.
नो आई एम नॉट गिविंग गारंटी सर.
उसको वीडियो दिखा दो. उसको वीडियो दिखा दो. बोलो कि हाँ इट इज अ गुड ट्रीटमेंट, यू कैन रिकवर. इनकरेज द पेशेंट. लेके आओ, रिकवर करेगा, कोई बात नहीं. लेके आ जाओ 11 बजे. 11-12 बजे लेके आ जाओ. कहाँ मेरा डिनर होगा? रात का 3 बजे डिनर होता बाबा. अभी भी हम क्लास ले रहे हैं.
अच्छा क्लास ले रहे सर. सर आप ठीक रहे तो सब ठीक रहते सर.
अरे हम ठीक रहे मरे जिए क्या फर्क पड़ता.
ऐसा थोड़ी होता सर.
तुम आगे प्रे करके चला जाना. हमारा कॉफिन पे खत्म हो गया बात.
सर आपका ब्लेसिंग हमारे लिए चाहिए सर. जी सर.
हाँ
आपका ब्लेसिंग हमको चाहिए सर.
काहे का ब्लेसिंग, काहे का कुछ, सब ठीक है.
क्या स्पेशल सर क्रिसमस?
क्रिसमस हमारा क्लास पेशेंट. और क्या होगा क्रिसमस? ईश्वर को प्रार्थना कि प्लीज गॉड हेल्प अस.
या
और क्या कर सकता हूँ क्रिसमस में? अब तो हम वो आई कैनॉट वेयर माई क्रिसमस ड्रेस व्हाट यू कॉल फादर्स यूनिफॉर्म रेवरेंट यूनिफॉर्म तो नहीं पहन सकता हम
Yeah, yeah, sir. Yeah, sir.
so it is only my memory
Yeah, yeah. Memory should be there, sir, every time in life.
या memory is there चलो ठीक है कल लेके आना
I,
वो
I
हेमरेजिक
bring
स्ट्रोक
it,
हुआ है
sir.
हाँ फाइन मीट मी हाँ इट्स ओके बेटा
Right,
नो
sir. Thank
नो
you, sir.
प्रॉब्लम
Thank you.
थैंक यू
Thank you, Alan.
हो गया बस मोटा मोटी खत्म हो गया और इसमें और क्या रामायण है बस हो गया और क्या है कल थोड़ा ये एमआरआई का अलग से पढ़ाएगा
हाँ सर
हेलो 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 So you see, within 6 seconds, I decide whether I have to take the phone call or not. Even the brain also decides in this 5 or 6 seconds, he has to accept the signal or not. अगर तुमने फर्स्ट 6 सेकंड में सही सिग्नल नहीं भेजा सही पेन यूज नहीं किया और अपना दिमाग लगाया तो पेशेंट हम जैसे लाइन काटता पेशेंट ब्रेन भी लाइन काट देगा आपका तो वी कीप द क्लास हियर यू मे आस्क मी क्वेश्चन प्लीज Walid from tomorrow please try to take the attendance huh
Okay,
at
Sastry ji.
8:30 will yeah from 8:30 we'll take the attendance only one power person has cleared
The attendance will come in
yeah
very
only
easy, Sastry ji, because Zoom will give you the attendance.
two person has cleared the you write down the attendance rules country name and for India you become the coordinator right and only one person has been able to clear the two people have cleared this fellowship one fellowship has been cleared by two people one is you and one is what do you call
सुनील
Sachin Sachin सचिन नो सचिन क्या नाम है उसका
सुनील
हाँ
सुनील
सुनील only two people मैंने आज ये I have informed the Kim's Karar shortly the certificate will be released from Kim's Karar with the signature of Chadian.
It's okay, Sastry ji.
Your name and his name has been cleared. Physical and rehabilitative, medicine and procedure. So any question? Question, Baba?
Hello.
Hi, yes.
Yes, sir, Dharam here.
हाँ धर्म tell me बेटा.
Sir, many patients, hemiplegia patients, they are facing the sexual disability. So, how we recover that, sir?
MRI का इमेज भेजो.
Yes,
Patient
sir.
का वीडियो भेजो.
Okay.
Formulas are simple 2 4 6 7 1 4 5 6 7 which occupies
Right.
the points.
Okay, okay.
Recovery is not a big possible better problem. क्योंकि concept तो समझ में आ गया ना मोटा मोटा.
Yes, sir.
You have understood ना? पेन भी तो है ना धर्म.
Yes, sir. Yes, sir.
कितना पेन है आपके पास?
Sir, अभी तो 2 है, sir.
हाँ?
Sir, I have 2 pens, sir, right now.
दूसरे तो नहीं होगा पैरालिसिस.
Yes, sir.
पैरालिसिस है मासिव ब्रेन डैमेज. दूसरे तो कुछ भी नहीं होगा. तुम ले जाके आगे बीच में धक्का दे देगा पेशेंट. कम से कम 4 से 5 पेन चाहिए. यू आर वर्किंग विद मासिव ब्रेन डैमेज. हम मैपिंग बता देगा बट अगर तुम्हारे पास वो स्टिमुलेटर नहीं होगा तो क्या करेगा?
Okay, sir. Okay, sir.
जब हम ही कुछ नहीं कर सकता तुम क्या करेगा?
Right, sir. मैंने बोला था बात करने के लिए, अभी नंबर दे दिया है, मे बी सर कल पे कांटेक्ट करें वो.
बाबा देखो इट इज इन्वेस्टमेंट, थोड़ा इन्वेस्टमेंट भी समझो लाइफ।
Yes, sir.
क्लिनिक बनाना है, इट इज योर कैरियर, राइट धर्म? You have
Yes,
only
yes.
you have around 10 to 15 years to build your career, right? अगर तुम 10 साल के अंदर, आने वाला 5 साल के अंदर, if you don't build your career, you will be obsoleted by the competition. हमेशा नोकिया को याद रखो।
Yes, sir.
नोकिया did not upgraded it, right? आज कहाँ है नोकिया? माइक्रोसॉफ्ट भी बचा नहीं सका उसको।
Right, sir.
Nokia is nowhere in the geography. So don't become Nokia. Then can you hear me, beta?
Yes, sir. Yes, sir. I'm here.
Yeah. So upgrade yourself with what?
Sure, sir.
You never thought that Reliance will get competition from BSNL. Did you ever think it? So when I went to Maharashtra, this time I came to know most of the people have switched over to BSNL.
Yes.
Did you ever think BSNL will become so big that it will give competition to Jio? We all thought in our time that BSNL will be sold to Jio.
Yes, sir.
हमने ये सोचा था सारा BSNL जियो खरीद लेगा, रिलायंस खरीद लेगा, बट देखो उल्टी गंगा बह गई बेटा। इंफ्रास्ट्रक्चर हमेशा मेरा 3 बात याद रखो। ऑलवेज गेट ए गुड इंफ्रास्ट्रक्चर, ट्राई टू डू बेस्ट इन योर क्लिनिक, डू नॉट कॉम्प्रोमाइज एंड प्रोड्यूस द बेस्ट रिजल्ट्स. It's not investment. It is not. You don't become like a trader. You are becoming like a trader of a share market, right?
Yes.
Don't do trading. You know, one of the biggest trader is ये है ना, क्या नाम, ये डर्मामेट बोलता है ना, क्या नाम है इसका, मैं भूल गया। ये मल्टीपल चेन स्टोर है, क्या नाम है ना, बहुत बढ़िया।
डीमार्ट वाला।
हाँ,
डीमार्ट वाले।
डीमार्ट, उसका मालिक कौन है?
दमानी सर।
हाँ, Damani is one of the biggest share market player in the world, in India, right? After this, he is dead now. May his soul is rest in peace, with all due regards. So Damani, someone asked Damani, sir, how can we become a trader? He said, I have also opened the trading demat account of my children, right? And I advise them, don't be a trader, be an investor. अगर आप शेयर मार्केट में भी अगर आप ट्रेडिंग करोगे तो आप बर्बाद हो जाओगे। धर्म समझ लो मेरी बात।
Yes.
अगर कैरियर बनाना है, सही में कुछ करना है, तो सही में कुछ करके दिखाओ, और आज करके दिखाओगे तो कल सक्सेस होगे। बट अगर टाइम पास करना है तो करते रहो। रही बात मेरी ड्यूटी, मैं तो आप मेरे को बोलोगे मैं पॉइंट भी लिख के दे दूंगा, 1357 भी लिख दूंगा, 1 और 2 तो आपके पास है, 3 5 6 7 का क्या करोगे?
Yes, sir.
अब ब्रेन को अगर स्टिमुलेट, मैंने अगर फॉर एग्जांपल मैंने ओमपाल सिंह को बोला 2000 रुपया दो, बोलेगा तो ना देगा ओमपाल, मैं ओमपाल को बोलेगा ही नहीं तो ओमपाल कहां से देगा? एम आई राइट और रॉन्ग ओमपाल? Then correlation has to be established. ओमपाल मैं तुमसे 2000 रुपया नहीं मांगेगा तो तुम हमको देगा? तुमको सपना आता है हमारा 2000 रुपये का?
नहीं सर, बिल्कुल नहीं।
हाँ,
नहीं सर।
तो आफ्टर मासिव ब्रेन डैमेज अगर तुम सही ढंग से स्टिमुलेट नहीं किया तो कहां से रिकवर होगा? You want to recover a brain damage which a neurologist also can't recover, which the best physiotherapist also cannot recover, and you want to recover with stimulation. और तुम्हारे पास अगर इंफ्रास्ट्रक्चर नहीं है तो तुम क्या करेगा? और एक पेशेंट में सारा इन्वेस्टमेंट निकल जाता है। अगर सही ढंग से काम करो तो एक पेशेंट इज इनफ। रिटर्न ऑफ इन्वेस्टमेंट इज हाउ मच? 1 पेशेंट। आउट ऑफ रिटर्न ऑफ कैपिटल इज 1 पेशेंट। उसके बाद तो सारा जिंदगी तुम्हारा ही पेन है, तुम्हारा needle है। Ultimately, you earn from your skills, not from the pain or anything. To develop your good skill, you have to have a good instrument. बिना इंस्ट्रूमेंट के क्या करेगा? मैं अगर बिना बोर्ड के, बिना इसके, और रोज अपने आप को बोर्ड पर इंप्रूव नहीं करेगा तो तुम लोग कितना दिन मेरा क्लास में आएंगे? हेलो हेलो हेलो,
यस सर।
So I have cut down my line in 10 seconds. My brain is tuned like that. In first 10 seconds, if the patient does not respond, हमको लग जाता कि ये phone is non-responsive. I cut down the phone. So if you don't give a proper responsive signal, brain will not respond. तुम कुछ भी कर लो, तुम जितना फिजियोथेरेपी करो, spasticity आ जाएगा, pathway repair नहीं होगा. Whatever you do, it will not come to success. So if you develop a successful game, success is a matter. For example, मुझे इसको हटाना है तो मैं कभी भी नहीं हटाता है. I always tell Sandeep to do it. Because मैं कुछ करेगा, सब उसका setup किया हुआ, right? I tell Sandeep to do it. So what Sandeep will do, he'll keep it carefully. The moment I do, I'll break something. So I don't interfere in those things which I don't know. That is why in brain there is a certain definite mapping, definite pathway, definite recovery. Then only you will recover. And that is the enjoyment of certificate. क्या रिकवर करके दिखाओ, आप बेसिलर आर्टरी को रिकवर करके दिखाओ, उसको रिकवर करके दिखाओ, तो जीवन का मजा है. खाली कहानी सुनने से थोड़ी ना मजा है. Ultimately, your success will come only at international level when you put up your case at international level. People were asking me who has done this case when Sachin posted his video. I gave a good explanation. It is not that people will not ask me. People will ask me, sir, what is this? Even the neurosurgeon was asking me, how did you do this? I gave him a good explanation. I hope you understood everything. Maybe Dharam, if you ask me questions, I'll give you the answers. But these answers will not be of much use because लंका को ढाने के लिए खाली राम और लक्ष्मण नहीं, पूरी वानर सेना चाहिए.
Yes, sir.
You are working with brain damage. You must recover the brain. Hello? Yes. ये शंकर नहीं, नीडो हॉस्पिटल है, Shankar. So now you see from this phone number also you understood. You asked Shankar and I told it is Nido Hospital. Cut down the line. Topic over. Brain is so fast in calculating. 1 minute में आपका सारा सिग्नल डिस्टर्ब कर देगा. I not accept it. What will you do? You will not damage the patient, but you will not be able to recover the patient. So क्या होगा? NIB is safe also, but if you are not able to do it, what will happen? क्या फायदा इतनी मेहनत करने का, क्लास अटेंड करने का? कुछ टेबल पे करके दिखाओ तो मजा आता है. That is called success. बेसिलर आर्टरी को लेके रिकवर करके दिखाओ, उसको GCS 15 पे लेके आओ, उसका डीकैनलाइजेशन करा के दिखाओ, तब मजा आता है. कहानी सुनने से क्या हो? स्टोरी इज ए स्टोरी. They are huge stories we can say. Success come only when stories are not there. You understood?
Yes, sir.
Did you hear me?
Yes, sir.
Yes, sir.
नमन, आज तुम बहुत दिन बाद क्लास में आए, क्या बात है? नाराज है क्या?
नमन नाराज सर.
सर कहीं बाहर था.
सर विपाशना गया था ये
तो आता ही नहीं है क्लास में.
बाहर था सर.
कैसे पढ़ेगा पता है. अच्छा है, हम तुम लोग का फुल टाइम टीचर नहीं ले, तुमको हार्ट अटैक हो जाता. तुम लोग का एग्जाम पास कराते कराते हमारा सारा चूल हो गया. That is why I never took any fees from you. तुम लोग का पास कराना हमारा बस का बात नहीं है. भाई don't think, do. Notes are there. Patients are there. अब नहीं करेगा तो कब करेगा? I am still alive. हमारा डेथ के बाद कौन गाइड करेगा बताओ? And don't tell me that I told this or I told that. Definitely, you are studying a very descriptive subject. Pain management is not an easy subject. इसलिए तो
अच्छा
स्लाइड्स दिया है, बैठ के स्लाइड्स को पढ़ो। खाली एक ही पंचा पॉइंट 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 करने से थोड़ी ना होता है। इफ यू डोंट नो द डायग्नोसिस, किडनी यांग करने से थोड़ी ना पेशेंट रिकवर होता है। यू मस्ट नो द परफेक्ट डायग्नोसिस and then with one needle you can recover the patient. This is what Tung said. If the diagnosis is perfect, the stimulation is perfect, the site of the needling is perfect, the recovery nerve and the recovery area is perfect, the reaction area is perfect, you will get result in what? Fraction of minutes. And that is called success. मैंने हमेशा एक ही बात सुना है, those who have done very clearly, वो केरला का है ना, पीजे, क्या नाम है उसका, दो Carolian student, they have done very good. I'm going to a Medical College. I'm going to treat the chairman of the college. I'm doing good. I've treated the Home Minister. I'm still his personal physician. So, success can come any day to your house. But if you close the door, दिवाली के दिन लक्ष्मी का दरवाजा बंद करोगे तो दिवाली कहाँ से आएगी? अच्छे से प्रैक्टिस करो, improve your clinic. You know why you don't have confidence on so much problem? Because you have never improved your knowledge. And if you don't improve your knowledge, and if you don't improve your skills, you will have only questions in your mind. No answers. If you don't have answers, how will you succeed? You will have no success. Stories are lot, success is less. मेरे को देखो, मैं यहाँ से कराट भी चलाता है, ये भी चलाता है, 2 मेडिकल कॉलेज और चलाता है, 15 न्यूरो सर्जन को चलाता है, सबको मदद करता है। I write books, I write so many things. Marketing, single man marketing, ऊपर से health भी जानता है, you know my health. But you see, after 22 hours of the work, I don't get tired because I enjoy my work. Again, I'm going to learn what? Intubation, I'm going to Chhattisgarh. I'm the physician of his hospital, Chhatrapal Vati. So I'm going to learn intubation and everything again. Again, I'm going to learn long general anesthesia, nerve blocks, especially what you call clavicle block and all. I'm going to repeat again and again. Then only we'll become master. I've done 9 fellowships recently in 3 years because I need to revise. Why I write books? Do I write books for you? No, for myself. If I don't repeat, if I don't teach, after 6 months, I will also become Dabba Gol. There was a very beautiful song in our time. Beach Bajariya Dabba Gol. Bol Hari, Hari Hari Bol. गब्बर सिंह का फट गया डोल, बीच बजरिया डब्बा गोल, बोल हरी बोल हरी बोल हरी बोल। ये अमजद खान का मूवी का मूव सॉन्ग था। अब तो तुम लोग को याद भी नहीं अमजद खान कौन था।
नहीं से याद है ना सर।
सर अमिताभ
काली
बच्चन
राम
और
का
अमजद खान का है सर।
काली राम का फट गया डोल सर।
हाँ,
काली राम का फट गया डोल।
हाँ, काली चरण का फट गया
काली राम
डोल,
का।
बीच बजरिया डब्बा गोल, बोल हरी बोल हरी बोल हरी बोल। अरे परफेक्ट है। चलो भाई, you have done very wonderful job. Study hard, get success, do a good practice. I'm sure success is yours. Success का 2 ही मंत्र है। You want to achieve success, you have to work hard. Everyone said, whether it is the founder of Neo, whether me or anyone or Cherian, everyone says success will come only when you bring success to it. Sachin, you can come. Just संदीप को इन्फॉर्म कर देना कि मैं कहीं
यस सर।
तुमको बुलाया और मुझसे उधर भाग नहीं जाए। क्या बोलता है, उसको रोज याद दिलाना पड़ता संदीप को, सर आप मत चला जाना, आपका टिकट विकट उसको याद दिलाना पड़ता। नहीं तो मैं क्या है, 1 मिनट में डिसाइड करता करार जाएगा। सुबह 10 बजे बैठा, अभी का फ्लाइट कितना, 12 बजेगा, हम करार जा रहा है। हम बेंगलोर जा रहा है, 2 बजे बेंगलोर जा रहा है। अरे सर आपका स्टूडेंट आ रहा है, अरे अरे भूल गया यार। आज एक सिपी
नहीं
चाइल्ड
सर
आया
सब।
रायपुर से। पीपल वर सेइंग हम लोग सिपी चाइल्ड में बोन मेरो स्टेम सेल नहीं कर सकता। किया है ना, 4 साल का बच्चा में क्या हो गया, कुछ नहीं हुआ। ब्रेन मैपिंग कर दिया, सीटी स्कैन निकाल दिया, कल ब्रेन मैपिंग कर देगा। कितना इजी है, 2 महीना में बच्चा टक हो जाएगा।
यस।
करने की हिम्मत चाहिए, सोचने की ताकत चाहिए। यू हैव टू ड्रीम, यू हैव टू इमेजिन, यू हैव टू लर्न, यू हैव टू प्रोसीड। नहीं तो काली चरण का फट गया ढोल, बीच बचरिया डब्बा गोल, बोल हरि बोल हरि 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 बोल। इट्स ए सॉन्ग, it is a song from India. It's a very long movie. I think it is 40 years old movie. This are 30 years old movie. So when I was a Doordarshan was there, only one channel was there. So we saw this movie at 2:30 on Sunday morning. So this song is my inspiration. काली चरण का फट गया ढोल, बीच बजरिया डब्बा गोल। बीच बाजार में डब्बा गोल हो जाएगा बेटा। You see, because of my success, I get so many phone calls without advertisement. Hello, hello. You see, I cut down this connection in 10 seconds. Hello, hello, hello. 7 seconds. And these 7 seconds are enough to establish the communication. If he says hello, 7 seconds are enough. I have showed below 1 second also you can get results. Success is yours, not mine. Hello. Thank you. Om Shanti. Huh? Om Shanti.
ओम शांति।
Good night, all of you. Thank you so much.
ओम शांति।
Thank you, sir. Thank
you, sir.
Allah Hafiz.
गुड
Thank
नाइट
you.
सर।
Good night.
Allah
थैंक यू
Hafiz.
सो मच।
Have a good health, sir. Thank you.
ओम शांति सर।
हमारे यहाँ गुड नाइट नहीं बोलते, हम लोग बोलते हैं अल्लाह हाफिज या नमस्कार या प्रणाम। ये गुड नाइट तो ये अंग्रेजी भाषा है, कोई काल के लिए।
गुड नाइट सर।
शुभ
गुड
रात्रि
नाइट
सर।
प्रणाम सर।
Good night,
प्रणाम।
sir.
नाइट
प्रणाम।
कभी गुड होती है क्या? नाइट ड्यूटी करेगा तो गुड होगा क्या? रात भर तक आईसीयू में ड्यूटी करेगा, वो गुड है क्या?
शुभ रात्रि सर।
शुभ रात्रि भी नहीं होता, हमारा तो शुभ ही है सारा रात्रि। नाइट ड्यूटी है।
प्रणाम सर।
हाँ प्रणाम। तुम्हारी आत्मा, भगवान
गुड नाइट
तुम्हारे
सर।
अंदर जो
गुड नाइट।
आत्मा और दुरात्मा दिया, दोनों को प्रणाम।
प्रणाम।
PM Sant Kumar, what is your question? Sant Kumar, you have a question? PM Sant Kumar, you have a question? You have raised your hand. Sanat Kumar, you have a question? Sanat, you have a question? PM Sant Kumar, you have a question? अब 4 बार पूछ लिया, नहीं है तो मैं क्या बोलेगा? पूछने तो बोलना, क्यों नहीं बोला?
No, sir. Again, reply.
PM Sanat Kumar, not you. He has raised his hand. I asked him, you have a question? You have a question? You have a
सर
question. The motion is ruled out.
सर ये मैसेज किया उन्होंने, कोई क्वेश्चन नहीं है।
मैसेज में लिखा है क्या कुछ?
हाँ कोई क्वेश्चन नहीं
वही बोला,
है, गलती से हो गया
मैसेज
होगा।
लिखा है उन्होंने। नो सर, ऐसा करके
कहाँ है उसका मैसेज?
चैट
अभी
बॉक्स में सर।
चैट में है सर, चैट में है सर। सर कुछ एक्सपेरिमेंट हो गया, ऐसे गलती से हो गया।
देखें तो कहाँ है इसका चैट?
सर उसका फोन हैंग हो गया, ऐसे लिख के भेजा।
अच्छा फोन है हैंग। अच्छा चलो भाई, तेरा
फोन
फोन
हैंग
हैंग हो गया, मेरे को छुटकारा मिला। बोल हरी 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 बोल।